So this operation is usually recommended in patients with large breasts. And when the breast size increases and the breast tissue grows, it also causes some stretching of the breast skin, and also gradual descent in the nipple position. So the operation has to address all these three problems. It has to reduce the breast volume, has to excise the excess of skin, and has to uplift the nipple position. And that is usually performed through the incisions around the areola, around the nipple, and with an extension towards the lower part of the breast. And mainly breast tissue is removed from the lower part and from the outer part of the breast. That creates the scar, which we call inverted T, because it is extending around the areola downwards, and part of the scar is hidden under the breast. This operation is done under general anesthetic, takes about 3 to 4 hours, depending on the size of the reduction, and requires 1 night hospital stay. That's a kind of brief description of this operation. I always tell my patients that breast reduction is an entirely elective operation. That means that we don't have to rush these decisions. We should take time to optimize any medical conditions that may affect the outcome of the surgery. And we try to minimize the risk of complications after surgery. So, for example, if the patient suffers from high blood pressure or is diabetic or has some heart problems, this has to be corrected and optimized before an operation. All patients are routinely sent to the clinic called pre-assessment clinic, where medical history will be reviewed and any medications that require adjusting will be addressed. And also, if the patient is taking any specific medications like supplements or blood thinners, aspirin and warfarin, they need to be discontinued. And obviously, this information has to be shared with the surgeon. All patients should have clinical examination, and if the patient is over age of 40, usually mammogram is also recommended to exclude any underlying breast problems. Smokers should discontinue smoking for at least 4-6 weeks before surgery, and also should refrain from smoking for at least a couple of months after operation. That is because nicotine is a very powerful substance that can compromise blood supply to the tissues and can cause significant complications such as nipple necrosis, wound breakdown, wound infection. So this is really, really important to refrain from smoking around surgery time. I also tell my patients to think about post-operative periods, so having good, comfortable, soft sports bra, which we usually advise about specifically for an individual patient, and also to take some time off from work to allow for full recovery. So I think that's the main things I think I'm talking about to my patients about. So every operation carries some risks, and obviously breast reduction is a surgical intervention, and there are some generic risks, like with any operation, such as bleeding after surgery, wound infection, wound healing problems, scarring, prominent scars, pain, discomfort. And there are also some complications specific to this operation. And since the operation requires moving the nipple position to the higher position, there are some incisions around the nipples, and that can affect the nerves running in the area of the nipple. This can present itself with numbness in the nipple area after surgery. It is usually temporary complication and usually recovers majority of patients, but in some patients could be permanent. Also, if the nipples require significant repositioning, so the distance of the lift is quite significant, that there is a risk of possible disruption to the blood supply to the nipples, and that can cause some wound healing problems or delayed wound healing, or in some cases, it can also cause nipple necrosis. This is a rare complication. Less than 1% of patients would experience that. But it is a significant complication. So it is very much individual decision of the surgeon and how this operation should be planned, and how to achieve goal of breast reduction without compromising nipple blood supply. I can think about two groups of patients that I'll be very careful in offering breast reduction. So first of all, the patients who are medically unfit, patients who have some significant medical conditions, such as chronic uncontrolled diabetes or uncontrolled high blood pressure, some previous cardiac events. And that is because this operation requires 3-4 hours of general anesthetic, and we have to make sure that you are medically fit to go through this operation safely. So I would always send this patient to an anesthetist for review and for opinion, skin opinion, if this operation can be safely performed. Second group of patients are heavy smokers, patients who smoke 20-30 cigarettes per day. These patients are at very high risk of complications, and I'm reluctant to offer them breast reduction. These patients can be referred to the smoking cessation service and be helped to stop smoking, but I would not operate these patients until they stop smoking. So I think these are two groups of patients that I think should not be considered for surgery at this point. A majority of patients are very satisfied with the outcome of breast reduction and do not require any further intervention. However, we have to appreciate that significant weight gain or weight loss can affect the size and the shape of the breast. And if this, especially weight gain, is significant, that can sometimes may require revision in terms of reducing breast volume again. I think it's also fair to say that some deterioration of the cosmetic outcome is to be expected with natural aging process. So minor adjustments may be necessary. I recently had a patient who had an operation like that 25 years ago, and with time she lost a bit of the volume. Nipple has lowered a little bit. So we have done small uplift and scar revision. It was a relatively straightforward operation. So short answer to this question is few patients require further operations, and if so, they're usually relatively minor and straightforward procedures.